All right, good morning. I'm Dr. Chad Versio, the chair of pediatrics here at RUHS, and we're lucky to have with us Dr. Jeff Leung this morning. We're going to have a hopefully very informative conversation on several topics, including social networks, including misinformation, how to potentially establish a good network of information for your social sphere, and also some specifics on how to think about the virus and spread in different areas. So, but first, we're going to hear from Dr. Leung on the local, statistics and update.
Okay. Thank you, Dr. Versio. So just a couple numbers, and these you can all get at the Riverside County Public Health website. First of all, our case count is over 5,000 now. We're at 5,248. The total number of deaths in Riverside is at 225. Our doubling rate has extended to about 23 days. And there are actually a whole host of epidemiology-related reports that should be posted soon to the Riverside Public Health website. They will include things like logarithmic curve, trended 7-day average for new cases, as well as trends on our testing and total testing done in the county. So, in terms of the overall situation, it looks like things are fairly stable in Riverside County. The hospitalizations and the ICU cases related to COVID, again, are in this, what the governor's office would refer to as a zone of sort of stabilization. But if any of you have been watching sort of Governor Newsom's press conferences lately, it does look like there will be a number of criteria that each county will have to be able to meet to continue along that reopening pathway. And some of those criteria are fairly aggressive or ambitious and include things such as having no deaths within 14 days. So I'll turn it back over to you, Dr. Versio. I know we wanted to chat a little bit about information as well as, how we can kind of support different organizations, including maybe our faith-based organizations.
Right. Yeah. So one of the things that I noticed fairly early on is I have a good friend that is one of the pastors of our church. And he would ask me questions periodically about, what to think about this, and there was just, a lot of understandable confusion. Was this the flu? Is it just old people that get really sick? And that kind of thing. And obviously, we were making significant changes at that point in society as far as locking down and that kind of thing. And so I thought it would be very helpful for our church community to have an update from a physician that's somewhat involved, obviously not to the degree that Dr. Leung is, but someone involved in the planning for, the healthcare response to COVID and that kind of thing. And so basically did interviews or conversations with pastors every 2 weeks to cover various topics. And so this is one of the things that I think has become more important as this has progressed. At that early stage, it was really just people weren't sure what to think, and had a lot of questions. And so I thought, well, let's do this as an update. So my first update, I kind of covered the differences between the SARS-CoV-2 virus and the difference between that and flu. I covered kind of some of the reasons of why it's a good idea to flatten the curve. Some of the statistics on the differences between age groups and how sick they would get, and then also the idea of doubling time and where different countries were on that, and whether they were kind of flattening their curve or not, and then talked about potential different ways to flatten their curve. In that, we talked about masking as well, because that was kind of early on when the masking orders came out. And I thought that was, kind of confusing to a lot of people because, traditionally in the US, we have never recommended masking. And now we were. And even the Surgeon General was confused about that, I think, originally when that kind of came out. And so that was kind of the first thing that I shared with our faith community. And then the second thing, which was a couple weeks later, was, it was confusing. I think a lot of people were seeing on social media and things like that hospitals weren't busy, which obviously we have experienced here at RUHS and across Riverside County, is that hospitals were under their normal operating capacity because of the the deferring of non-urgent surgeries. And so I covered kind of some of that, and we were talking about potentially starting to reopen at that time. And so I reviewed, the possibilities of a second peak if that were done too quickly. I reviewed our doubling time at that point, which was still fairly short. We're so, happy to hear that it's slowed down to as long as 23 days, because at that point it was, I think at that point I think it was still 4.6 days when I had recorded this, and then just reviewed some of the San Bernardino and Riverside County statistics, and then some of the world statistics, and what things might be important for people to look at. So, I think it's easy for people to just look at the numbers of new cases, or the number of total cases, and the numbers of deaths, but really that's not very helpful in comparing country to country. And some of the other statistics, like deaths per million population, or tests per million population, are also important to include, because that gives you an idea of how countries are approaching this. And then one of the other ones that I thought was, important for predicting, future severity, or, what's coming up, is also the number of serious or critical patients, because as you know, Dr. Leung, a high percentage of those that are in the ICU actually do die. That does vary by region quite significantly. So in Italy, it was 80% of the deaths overall, although in one of the hospitals it was as low as 65, and then in New York it was again over 80%, whereas we haven't seen quite that mortality level here, fortunately. So those were some of the things that I covered in our second, kind of interview or discussion. And then the third one was really a response to some of the misinformation that's come out, and that has become much more important, much more prevalent. People have probably seen acquaintances of theirs on social media sharing things like the interview of the physicians from Bakersfield, and then also the movie Plandemic, or the trailer for the movie Plandemic. And those were unfortunate things that have contributed to a lot of misinformation. It's understandable that people would be wanting to to open up the economy and wanting to reopen things, but and so we're tempted to believe those, probably because of that desire, but both of those things contain a significant amount of misinformation. And so the third one was kind of reaction to that, and actually it was an interview or a discussion between myself, Walter Klein, who's one of our MICU physicians here. We had an MICU physician from New Orleans that participated, an infectious disease physician that participated from Cedars-Sinai, and then an ED physician that participated from Loma Linda. So I'm going to go ahead and share, if I can remember how to get to the chat, I can share that in the chat, so that if people did want to access that discussion, they're welcome to. And in that, we kind of covered some of the dynamics of asymptomatic spread, and why that's made this virus so difficult in particular. We covered, a lot of things that I discussed in previous discussions with the pastors. And so hopefully that would be an informative thing. So I don't know if you thought of any questions as I was kind of talking about that, Dr. Leung, or.
Yeah. So maybe just to interrupt you for a moment, a lot of these topics are fairly sophisticated topics that I think
Yes.
Would actually be very useful to cover with our own, provider groups, our staff, our internal organizations, let alone, kind of wider communities. I am curious, because with a different audience, what kind of feedback and questions and response you've gotten from maybe your church and your group from these presentations?
Yeah, so I have not gotten any particular questions. We've asked for them each time. I have, well, I shouldn't say I haven't gotten any questions. I haven't gotten directly sent any questions by the congregation. One of my good friends is one of the pastors, and so we kind of talk through, and he raises questions to me based on questions he might have or his wife has, and that's kind of helped me kind of think about what should I cover in the next update. And he's actually kind of suggested when we should have the next update and that kind of thing at times. And so yeah, it's been a kind of a good dialogue between the two of us and understand what's the layperson's perspective, what are the questions that they have or things that they might not have clear. He does have a little bit more of a background in medicine because he is a chaplain, he is a chaplain, not currently functioning as a chaplain for the most part, but he does have that background of how things work a bit in healthcare, and so he's able to kind of bridge that gap.
And I don't know if it's convenient, but you do have some videos or links to some examples of these discussions or presentations. And I don't know if that's something you can either share out in the chat box or if there's a clip that we might be able to see.
Yeah, I did share the first one in the chat box, and then I'm sharing the second one right now, and I accidentally started to play it. And let's see, where's the trying to go back and find the other one, the first one, which I can't find probably too quickly. Yeah, this is something that I think is really important for people to really look to impact their social sphere or their social network, and try to decrease the amount of misinformation, constructively engage with, if they're involved with a faith community, their faith leader. I think one of the things that we've been interested, Dr. Leung, is actually establishing a network or more connections with other faith communities to help understand, as this is overall a very confusing time for everybody, and how to think about the possibility of increasing the amount of capacity or increasing what churches can do. I think both of us recognize the immense value that a faith community offers to the people that participate in it, that it brings, or it affects and increases or improves multiple aspects of their health, if they're able to participate in that in some form. Many have obviously gone to virtual meetings or discussions or worship services, and that's great, but that's still not the same thing as engaging with a group of people in person. And so as we kind of go through this process of reopening, I think that physicians and pastors will have to probably work in conjunction, to really make sure that this is safe as possible for their congregants, and obviously people of other faith backgrounds as well, whether it's Christian or Hindu or Buddhist or Muslim or anything, that these are all really, really important communities for people's health.
So one question I have, Dr. Versio, is there seems to be sometimes a tension between being able to participate maybe with your faith-based community completely, and sort of following best practices or safety practices to prevent the spread of coronavirus.
Right.
And I don't think all of us necessarily see it as an either or, but where do you think that tension sort of comes from?
Yeah, no, I mean, I think that it is very much a challenge. If you think that, and obviously faith communities span a wide gamut of practice, of size. And so if you think of a mega church that has over 1,000 people attending, or several services potentially on a weekend, and sitting generally historically close together, singing, all kinds of things. Those are ripe conditions for for rapidly disseminating a virus. Especially one like this. And so that those are conditions that, yeah, would really increase the probability of overwhelming our health systems, which obviously we haven't seen so far. But and so that I think is one side of things. But then, as you said, people, really value their community and want to participate in some form in their community. And so one of the things that, I think people need to consider is in any of this, whether it's participating in their faith community or even their personal social life, is the situation and number of people that they're inviting, or participating in whatever group they are. It's probably, there's it's not like in general you get infected with one virus particle and then you get the flu or COVID or whatever. You have to be contaminated in a sense with many virus particles, and the more that you get contaminated or infected with, the more likely it is, especially it seems like with COVID, that it's going to have a more severe course, which is why, I think some of the healthcare workers have probably been more affected in areas like New York, where you may have, or Italy, where they may not have been able to use full PPE, or their PPE may have been breaking down because they didn't have, enough N95 masks. And then they were in an area where there was a high viral load. And so, one of the things that we were talking about is before this is that 6 feet is not a magic number. If you are sitting in a very small office space that's only 6 feet and you happen to sit 6 feet and one person sits on one end and one person sits on another end, that's probably not adequate. If one of those people, for sure, if they happen to be infected and were coughing and sneezing and that kind of thing, but probably isn't adequate if you spent hours and hours and hours in there together all day, even if one person was an asymptomatic carrier. And so, the same thing goes for if you have multiple groups of people. It's one thing to be outside and physically distancing by 6 feet, and it's another thing to be inside in a relatively, small space for that number of people. And so there's a couple of examples that make me think of this. One is, there's a church choir up in Seattle that had 60 people. They chose to meet during the early time of Seattle's outbreak, and they reportedly physically distanced, and chose to sing. None of them were wearing masks, but they chose to sing, and 45 of the 60 people ended up getting infected, and 2 of them died. And that may have been because, they were in an enclosed space. Obviously, if you're singing, you are exhaling much more forcefully than even talking or just sitting there and just simply breathing. And so it's much easier for those viral particles to get out into the air.
Yeah, it's interesting because I think they were saying, if you are singing or yelling, you've effectively doubled at least the distance that you probably should be physically distancing at. So, if we're normally thinking about 6 feet of space, you probably need at least 12 feet because you're really projecting more particles in a larger sort of radius. It's also interesting because when we look at the experience of South Korea, they were initially having trouble sort of containing and sort of flattening their curve, and they thought they were doing all the right things, and eventually they discovered that one of the main challenges was actually many of their faith-based communities were continuing to meet.
Right.
And they actually had to take very drastic measures. They actually broke up the meetings and sort of disallowed that and really had to leverage enforcement And we're not advocating that in any way, but that was a big challenge for South Korea. They actually found that that was one of the main ways that the infection continued to spread, even though they thought they were doing everything else correctly.
Right, and I think both of you recognize there's potentially constitutional concerns there, but I think that's where it's so important for faith communities and physicians to work together to do things that would decrease the likelihood of that spreading, and figuring out creative ways for people to participate in their faith community without potentially infecting a massive number of people if somebody was an asymptomatic carrier or was sick. And so this is one of the things I've been kind of thinking about over the last couple of weeks is the social network, and people's social network, whether that's at work or in their personal life. And as schools are starting to reopen, they're taking steps to diminish the social network for students. So for instance, they're likely, instead of having students go between classrooms for this next season when school opens up again, they will have teachers go between classes, and doing things like that to decrease the amount of flow in between classrooms and things. And so I think some businesses are starting to think about this as well, as how do they keep smaller groups of people that work together from and obviously we've had to do this with transitions to a lot of virtual activities. But once things start to open up, I think people really need to think about, how do we decrease spread through a social network? And then one of the things that we were talking about this morning that's really important is the contact tracing of that, if it were to happen. I wanted to show a couple of things because I sent an article to Dr. Leung last night that I will put in the chat box, and it has some very interesting case studies. One of them was the choir that we talked about already, but I'm going to try to share my screen here and see if I can find it. Okay, so hopefully you can see that. Can you see the kind of the diagram? Yes. Okay. So this was a case study from a restaurant where they looked at there was one person who was infected. I believe it was at this. Oh yeah, it's at this table, at the middle table, the one that's marked orange, and you can see here where the air conditioner was blowing, and you can see who got infected with this with coronavirus. And so so there are people basically sitting downwind of the infected person, and the people at the same table were infected. And then also two people at the other table that was upwind, interestingly, got infected. And the theory of that was because of possibly turbulent airflow, whereas the people that were not downwind, that were out of that jet stream, so to speak, did not get infected at all, which is very, very interesting. And then this one was showing a call center where one person happened to come to work and infected a lot of other people on their floor. And so you can just see, they even though that they were mingling in the lobby, potentially in the elevator, there was really no other cases on other floors that could be directly linked to this individual. And there's only a few other cases in the building, whereas on that floor, there was a significant number of people that were infected. And probably that's because, the amount of time that they spent in this workspace together, as well as I'm guessing that they weren't using masks or anything at this point because it was quite a while ago. And then they also reviewed some of the birthday parties, funerals, and the ways that people could spread infections through those kind of gatherings. And so anyways, this kind of article really illustrates how it can spread through a social network, whether that's at work or within a school system or within personal gatherings that people might have. And so, yeah.
And sorry, Dr. Versio. So I think first of all, I would encourage people to take a look at that article. It's a great synopsis of sort of how we think things could spread. One of the things that I found striking about that article was it talked a little bit about chances for spread in areas like supermarkets or places where we commonly may actually take a lot of precautions
Right.
versus sort of other scenarios. And it seemed like they were suggesting that the risk at a supermarket might actually be much lower versus again a social gathering or a regular workspace where we're not cautious about either the density or the airflow or other things like that.
Right. Yeah, and the amount of time. Yeah, I think that was one of the other big things is, in the supermarket, generally you're not following the same person around for your whole time to the supermarket. You might, cross paths with multiple different people, but inhaling a few viral particles from one person, over the time that you just happened to cross their path if they were an asymptomatic carrier versus being, at a gathering where you're there for several hours, very different scenario.
Yeah. So, I know we've covered a lot of different topics, but I wonder, Dr. Versio, if we have some time towards the second half of this hour, if we might even be able to open things up, and I'm curious, what other people are thinking,
Right.
what questions they might have, and maybe what some of people's experiences might be with their own faith-based communities, if they're sort of open to sharing.
Yeah, that would be wonderful. Yeah, if people want to place things into the chat, or I'd be very interested to hear about that, or questions that you might have. So definitely interested in your thoughts. So far, not seeing anything in the chat box, but Dr. Leung and I would be, very interested in your response and seeing out what you think about, the communication within your faith community if you do participate in one, and what their hope is for or thoughts are on reopening. I think both of us strongly support the value of faith communities and that they really provide very important services.
And Dr. Versio, one thing I'm curious about, because I believe most churches and faith-based communities are large enough where they do have healthcare workers or physicians or people with probably some more knowledge in the area of coronavirus. But to me, it seems unique that you've had such a proactive role at your own church, and I'm curious how that may have started. I know you mentioned that you're good friends with your pastor, but how did everything start up?
So they had actually done I think as they were being required to stop meeting in person. They had done a video update with actually the ED physician that was included in the dialogue that I have with multiple physicians, and he'd done kind of just a little snippet on the coronavirus and that kind of thing, and what people should do to stay healthy. And then I talked to my friend that's one of the pastors fairly frequently, and he just started asking, was asking me questions. And then I when the masking policy came out, I thought, well, this is really an opportunity to help people understand this, because it's probably confusing. And I'd been on the leadership team there several years ago, so I know the main pastor reasonably well as well. And so they kind of talked about it, and then we just kind of took it from there, and have done periodic updates about every 2 weeks, because that kind of seemed to be the time frame that things were significantly changing. Although in our world it's changed on an hourly basis, I know for you. But as far as social changes, it's been about every 2 weeks. We didn't feel like updates were needed more frequently than that. So we have a couple of questions in the chat box. So one of the ones was questions within the local church about local plans for reopening churches, and I don't know if you want to take that, Dr. Leung. No, you're muted somehow.
So I don't have a great answer right now. I do. I think many churches are trying to be proactive, and some are either sort of even discussing within themselves what are the best ways to open up. Should there be a date that they plan around? Should it be the end of the month? And I think everybody is looking for direction either from their own county officials or the state officials. Now, from the state standpoint, what we can say is, the governor has allowed for the reopening of retail with curbside pickup, and sort of has hinted at the gentle opening of a few other select businesses. But in general, that second part of phase 2, and this terminology is all really confusing. I think it really almost sounds like 7 phases, but they put it into 4 phases, and now we've got part A and part B. The latter part of phase 2 includes things like in house dining at restaurants. As well as sort of offices where you may not be able to work remotely, and definitely I think churches, although they're not directly addressed right there, are probably somewhere after. And so from the state standpoint, we've seen a little bit of this back and forth already, where some counties have tried to move a little bit faster than the state, and the state has come back and either closed beaches, or they've gone back to those counties and said, you need to pull back immediately or your disaster funding will all be at risk. So I think it's very clear from the state's perspective that they want us to follow their guidelines, and that counties really cannot get ahead of the state unless they're sort of approved to do so. So that's a long-winded answer for saying, I don't think we've gotten enough guidance from the state yet to know when churches sort of will are allowed to open along those criteria.
Yeah, and I think. Oh,
yeah.
Sorry.
Go ahead. Go ahead.
No, I was going to say, I think churches, as we've already kind of discussed, present specific difficulties as you consider reopening. How many people should be, allowed. And I know pastors are really considering, especially larger churches, considering paring down the number of people that are allowed into a particular service. But but beyond that, how do you factor in the singing? How much does masking affect how effective is that as a way to decrease spread if people are doing things like singing or that kind of thing? And so there's a number of dynamics that make this quite difficult to just say, well, it's safe or it's not safe, because we like to approach things as safe or not safe, but really there's a continuum of safety, and churches kind of pose some significant difficulties along that continuum. So I think this is a really challenging thing for the state to think about. One of the other questions that we got is, updates on how funerals could handle services. There's an example of a Catholic cemetery in Culver City that opened, and everybody's required to wear masks and social distancing and things like that. And so, I don't know if you have any thoughts on that.
Yeah, I think many groups, including churches as well as restaurants and other organizations, have been taking sort of liberties with outdoor gatherings. And I think part of the reason for this is there's not clear guidance, and I think some people are interpreting, the sort of guidance or the guidelines from the state as saying, you need to follow these guidelines for indoor activities. The state has actually not said this only applies to indoor and doesn't apply to outdoor. So I think groups have been trying to kind of test that out. So that's why you see some restaurants trying to have kind of outdoor seating. You do see churches and different groups trying to handle funeral services or other gatherings in creative ways. But I do think how counties respond there will be a lot of variation. For instance, I was in La Habra, which is in Orange County, the other day, just driving through, and there was a group that was trying to gather for a birthday party outside, and it was very obvious that they were trying to physically distance. But the police stopped there and asked them to break up that gathering. And some counties may be more aggressive about that than others, but we have not had clear guidance, and definitely there has not been an exception that's been made sort of for gathering outside. However, we know from a scientific standpoint that outdoor activities are probably safer than indoor activities for all the reasons that you already shared.
Right.
Yeah. So.
Yeah, and then one of the other questions that was posed is, many of the churches do either offer their space or directly run support groups that like Alcoholics Anonymous, Celebrate Recovery, Narcotics Anonymous, which are really, really important. I am specifically avoiding the term essential since that's been a distinct category by the state, but they're very much bordering that. I mean, with the mental health stresses of our current situation, you really worry about people potentially struggling with their addictions and things like that. And these groups are obviously so helpful in sharing the burdens that are going on in society, and then also decreasing the risk for that. And so I don't know if you want to say anything about that.
Yeah, I completely agree. I think we would all agree that those groups are vital, for many people in terms of maintaining sobriety and kind of getting on the right path, and definitely, having that type of support means all the difference for many people. Without having any official or formal guidance, from our county, public health or legal council, I would say that if you read the state criteria for what meets the definition for essential workers, the categories are fairly broad, and there's at least 7 or 8 pages of different categories of essential workers. And so whether we're talking about employment or support groups such as this, some people are looking at, can we fit within certain definitions? Again, without conferring with anybody else, I do think you could make an argument that for support groups that are really critical for maintaining sobriety, and I think this crosses more over into addiction and health or medical health or behavioral health that is sort of more traditionally defined. I think you could make an argument that those are critical services. Now, that being said, even when it comes to healthcare services, I think there is an expectation that as much as possible, we do anything sort of virtually or remotely whenever possible, that we kind of safeguard those situations. And then if we do have to, for instance, even in a healthcare setting, see people in person, that we're kind of taking the appropriate PPE precautions. So I think this may be a gray area, but a very good question.
Yeah. Yeah, and I think all of us hope that that those kinds of things can reopen as soon as possible. But regardless of how they do it in a wise way so that they decrease the risk of spreading within that, vital community. Any additional questions in the chat that people want to raise that we haven't kind of addressed? These have been some wonderful questions.
Good transition.
Or you're welcome to unmute yourself as well and ask the question too. So,
while we're waiting, I would encourage, I think one resource that is not, the top resource that we're always thinking about is if you don't already sort of watch these or kind of try to follow up on them, the governor's press conferences, I think, do give us a lot of content on where the state is believes we're headed, and kind of the most up-to-date guidelines and recommendations, which do seem to evolve a little bit with each day. So, if you are taking a long commute or you have some extra time, I would encourage maybe trying to listen to some of the videos. If you just look up, Governor Newsom press conference, and they'll usually, oftentimes, Secretary Galley or the rest of their team is sort of involved as well. But I think they are a source of information that many of us are not regularly seeking out because it's not necessarily convenient, even though what they're saying is really going to set the pace of how we reopen in California.
All right. Well, any other things that you feel like we should talk about? Try to cover?
I think this has been a good discussion. Dr. Versio, we're grateful to you for sort of sharing, something that I think is really important professionally, but also important personally, and just all of us thinking about how we can have the greatest influence in our own spheres and social circles. I really respect, how you've been so proactive with your own group, and I think, I'm sure that it's made a difference with your church. So thank you for doing what you're doing and sharing that with all of us and helping us have this conversation today.
Sure. No, thank you, Dr. Leung, for what you've been doing for all of us at the EOC. I know that the pressure over the last 2 months must have felt immense. We're grateful for everything administration has done here at our UHS. It's been a phenomenal thing to see how well the administration here has handled it. Obviously, people are reading about. I've read about other hospitals in other states and things like that that haven't had the kind of leadership that we've had here. So it's been wonderful to see that. All right, that concludes our webinar for today. Please send in questions to Christine or the others from our public relations team, and so that we can try to answer those in future webinars. Thank you very much.